Okay. Hi everyone, I'm Natalia. We've met before in a couple of the other videos. This is my friend Molly, and we're both studying
Yes.
dual in nursing and midwifery at UQ. We're both just going to talk a little bit about why we chose to study nursing and what we love about it. So, Molly, what would you say?
So I personally chose nursing just because of the appeal of it's such a versatile degree. So you can go into so many different areas. You don't just have to stay clinical, like you can go become a nursing manager, let alone all the different areas of nursing from like emergency to pediatrics. And just, it really just appealed to me. Just love looking after people while practicing like your skills, and you get to do some pretty cool stuff, I reckon. But yeah, I think that's why I chose it.
Yeah, I'd have to agree. Like the versatility of nursing is pretty amazing, and there are just so many opportunities for learning. Um, Yeah, and it's pretty amazing. We get to do placement throughout the whole of our course. Each semester, we get either like the midwifery or the nursing placement, and it gives you an opportunity to go out into the workforce. So, what do you reckon your favorite part about nursing is?
I think it's definitely the placement. So it's so good to practice the skills during uni, go to lectures and that sort of thing. But then to actually go into a hospital and actually care for real patients and work alongside like real nurses, reporting back to the doctors and that sort of thing. I just love the first-hand experience we get, and we get it from so early on in our degree. I think it was like within the first month we were like in the hospital, and still do it now throughout the degree, which is awesome, I think.
Yeah, we were so chucked in the deep end. You kind of chucked out into the workforce on your first, like you've done one, not even one semester, first week of uni, and they go, okay, yep, out into the hospital you go. And it's pretty scary, but you
Literally.
learn so much, and it's just, yeah, it's so valuable to do that. And you get confidence. You get so much more confident as you go on. So it's
Definitely. I remember it was like, sorry, like in the first month, I'd already like delivered a baby, and they were just like, I was just a student. They were like, come here. And I was like, oh, okay. So yeah, you really do get chucked in the deep end, but I think that's the best way to learn for me personally. Like you just learn so much straight away and just put it all into practice.
yeah, and it's amazing too because you get, you learn a certain amount of content at university, and then you go into placement, and the amount that you're actually learning on prac is just, it's exponentially larger than what you learn in uni. So is there anything you wish you had have known about the course before you went into it?
I think I definitely underestimated how much nurses actually do. So we're in year 2, and there's already been so much content and just so much knowledge that we do need to have to be able to do what nurses do. And I think I definitely underestimated that sort of part of it, but it's so good. Like I think I prefer to know as much as I do, because you can really have a holistic view of a person and that sort of thing. But yeah.
Yeah, I feel like the placement really brings it together. After you
Mm.
say you have a lecture, and then we go into our CBL class, which is clinical based learning with the dummies, and you get to like maybe do some case studies and practice the actual skills on the dummies. And then once you go out on placement, it's just tying all of that in together, and you kind of have to be aware of, all the way from physiology up to like why you're administering particular medications, and the whole pathway of care for patients. It's pretty amazing. Yeah. So the other thing that's really incredible about both nursing and midwifery is the opportunities to do, or one, like further studies, and two, opportunities to go to different places for your placement. So unfortunately, this year there were international placements that were cancelled to Nepal and India, and both of us had applied to do that. Um, and we would have been able to go to one of either Nepal or India and practice clinical skills being in a different setting, as opposed to just being at a metro hospital in Brisbane, and learn about how, placement and nursing practice is different in like a rural community. So we were pretty excited to maybe be able to do that. But
Mm.
why did you want to do the overseas placement?
I think it was just to kind of, yeah, get out of the metro hospital. So we're both at the Royal Brisbane, which is a pretty large hospital. So to kind of go to India and Nepal, where the medical supplies aren't as good, and just getting a sense of a different community, a different culture, and just seeing what it's like to nurse, also with sort of a language barrier as well as a cultural barrier. And just, I think I just would be so annoyed that we missed out on it, but it's a great opportunity that they offer to actually go over and do those international placements. Yeah.
Maybe next year. Yeah. There's lots of opportunities for rural service as well. And I've recently just come back from Roma and St. George, where I was with a bunch of other healthcare workers, and we went as a part of a Grow Rural Health Workforce team. And the students, we were just learning about how rural service differs from like service in the cities. And it was really, really eye-opening and pretty fascinating and amazing to see how healthcare systems are so different in small communities, because like Molly said, they don't have access to as many services, they don't have access to specialists or equipment and funding, things like that. So it's a really good opportunity to go to a small community and just be part of it and see how things are different. So yeah, basically there's lots of things that you can do with nursing, and it's not just you're at uni and you get placed at one hospital. You'll get the opportunity to go to many different areas. And so Molly has been at the Royal Brisbane with myself for the last 2 years. But next year she's actually going to be finishing up her nursing. And so she's going to be in, we're not sure yet, another hospital.
No, not sure. Another hospital, and hopefully like another department. So we've both been on a general surgical ward, which I have found has been great for our first and second year. Because you see so many different things, and you get to practice all the skills you've learned. But yeah, so it'll be interesting to see where I'm next year. Maybe emergency, I'm thinking, but yeah, who knows?
So what is there that you can apply for next year? Do you know what the
So I think I've got to go through and rank sort of where I would prefer to be. So I'm thinking maybe somewhere like emergency, even pediatrics would be something completely different altogether. But I think it would be such a great experience, and just to have that knowledge. Also maybe thinking ICU, just to have a look at really critical patients and just bigger, like their needs, like their cares would be huge. And just, yeah, I just kind of want to try everything really.
Exciting.
But yeah.
So do you have any little tips or tricks that you feel like are helpful for placement?
For placement, I think my biggest thing, and I think for you as well, Nat, what has helped us really succeed is kind of take initiative, even as a student, like straight away from the start of the shift, kind of introduce yourself and kind of tell them what you can do and what you want to do that shift, sort of thing. And then straight away start what needs to be done for the day. I think for both of us, just throwing ourselves in the deep end, just taking opportunities, has really helped us become more confident and get the most out of the experience.
100%. Yeah. Something else I reckon we did pretty well as well was asking questions, because the nurses that you're with absolutely love it when you are asking really good strategic questions. You're always finding something to do, because sometimes on a shift you'll get to 9 p.m. and all the patients have had their medications, they've finished observations for that night or something. But Molly and I don't sit still particularly well, so we always go and seek other things to do. Like there's always cleaning, there's always packing or restocking shelves, things like that. And if you can sort of engage a lot more with the staff and try and engage with how the ward runs, you'll find
exactly
rewarding, and the nurses and the other staff will really appreciate you being there.
I think it's really good. So when you're on placement, you get put with one nurse, but as like the shift comes towards an end, especially on an afternoon shift, which doesn't finish till like 11 o'clock, asking other nurses if you can do anything, and they really appreciate that, even if it's just something basic like asking the patient to fill out some paperwork or just checking in on a patient or something like that. It just really helps, and it kind of puts your name out there a bit, and they'll kind of recognize you throughout the semester. So I think it's just definitely asking questions and taking initiative would definitely what we've done well, I think.
I agree. Another question for you too. So Molly's had a job during placement, and I think coming into nursing, knowing that is placement can be a bit nerve-wracking and confronting. But do you want to just talk, like maybe talk about how you managed to have both a job and then do your uni work placement?
Yeah. So it was sort of hard to get my head around it, especially starting placement so early and still having full-time uni and then trying to balance a part-time job. But I think it's super important to make sure that your job doesn't come first, so that you're not doing too many hours, and also that your workplace is aware that you do have placement. So you don't want to be doing a shift that finishes at 11 and then starting early the next morning at your work. So I think it's important that you kind of tell them to begin with, like, look, I'm doing this amount of placement, this much uni. I'm only looking for like 10 to 15 hours. And these are the days I can work. So I think it's kind of, I was sort of lucky that I did have a workplace that did understood and catered to that. But yeah, it is a bit of a struggle.
Yeah.
But yeah, I think just as long as uni comes first and that you're not too drained to do placement, it's all right to balance.
Yeah, absolutely. And there's always opportunities for casual, like I personally have a casual work through UQ, and it's been really good because it's a lot more adaptable with times to shifts and things like that. So I think there's always options. And then Molly's going to be looking for the job in assistant in nursing, which is a really good way to sort of finish off your degree and start making connections in workplaces. Do you want to just talk about maybe what an AIN is?
Yeah, so an AIN is pretty much just sort of, so it's assistant in nursing. So you're the nurse's assistant. So it could mean restocking, helping the nurses with sort of cares with the patient, so getting them up to shower, getting them to the toilet. It can also mean some patients who are higher needs and need more cares throughout the day, they will have one AIN dedicated to them. So you pretty much just watch them, make sure that they're not wandering around, especially if they're older and they have like delirium or mental health problems as well. It's just to have sort of one person one-on-one with them to kind of cater for their needs and just help the nurses out, really. So as a nursing student, I know a lot of people in our degree have got these jobs. I'm starting to look for one now because I just think it'd be really beneficial, especially for our last year and then graduating. Yeah,
it's fantastic. It's really exciting. I'm really excited.
Yeah, I know.
We can probably both agree that nursing is a very, very rewarding degree, and we both loved it. And yeah, just the more you engage and the more that you talk to your students that are on the shifts, and talk to the nurses, ask questions, learn as much as you can, the more you'll get out of it, because the placement is really where you can put your skills into practice and develop as a person. And Molly and I, we are so excited to graduate because it's just something so yeah. But yeah, well, thank you so much, Molly, for that. And
no worries.
Hope that there's lots of nursing students pop up from Bundy. And if you have any questions, let us know. Thank you.
Thanks, guys.